Hi everyone, I'm Ashley Seeley and I would like to welcome you to my presentation on lung cancer in youth ages 13 to 16 and the prevention of lung cancer. Here's a brief video about youth and smoking from the Center for Disease Control and Prevention in 2014. I hope you will watch this and you find it as interesting as I did. It has some very awesome facts about youth and smoking. Let's take a quick look at lung cancer. Lung cancer occurs when the cells in your lungs change and it can spread to lymph nodes, which are little round bumps that you normally can't feel unless they start to grow bigger than normal, along with other organs throughout your body, which is referred to as metastases. Smoking cigarettes is the main cause of lung cancer, you guys, and about 90% of lung cancer cases result from smoking cigarettes. A lot of people ask what causes lung cancer. It's hard to pinpoint exactly what causes everyone's lung cancer, but smoking causes 80 to 90% of lung cancers in both men and women. Secondhand smoke exposure, smoking marijuana, vaping or the use of e-cigarettes, chewing tobacco and smokeless tobacco, as well as exposure to pollution and radon. Some signs and symptoms of lung cancer include shortness of breath, coughing up blood, a new cough that doesn't go away, chest pain, unnecessary weight loss, wheezing when you breathe, frequent lung infections that can include pneumonia, bronchitis, or emphysema, and hoarseness in your voice. Lung cancer is the second most common cancer in both men and women in the world. A video on how smoking affects our lungs. We have to have our lungs in order to breathe and live, so why would anyone want to jeopardize their life by picking up a cigarette, using smokeless tobacco, or using an e-cigarette? Facts about smoking are very important to stay up to date on because smoking cigarettes is the leading cause of preventable diseases and deaths in the United States. Cigarettes contain nicotine that is highly addictive stimulant in tobacco, and about 90% of tobacco users start smoking before the age of 19. Smoking also causes death 13 to 14 years earlier than not smoking, and teens who smoke are 3 times more likely to pick up drinking alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine. Have you ever wondered what was in a cigarette? I know I have, and I was shocked to see so many chemicals, including paint, ammonia that is in toilet cleaner in your household, methanol, which is found in rocket fuel, carbon monoxide, which is found in car exhaust, arsenic, that is a poison, methane, that is found in sewer gas, butane, which is lighter fluid, stearic acid, which is found in candles, along with hydrogen cyanide, which is found in rat poison. This is only naming a couple of the chemicals. At least 250 out of over 7,000 chemicals that are found in cigarettes are known to be harmful. I found some facts on this image from Dr. Shizakumar in 2019 that it is shown in people who smoke cigarettes, use smokeless tobacco, and the use of e-cigarettes have a greater risk of lung cancer. All of the chemicals that are in these products causes damage beyond repair, and they are highly addictive. The risk of lung cancer increases with the amount of time and number of cigarettes you've smoked throughout your lifetime. There's no real way to prevent lung cancer, but you can do your part by reducing your risk of being diagnosed with it. Facts about using e-cigarettes and vaping are that young people who start are more likely to start smoking regular cigarettes, which will only lead to a greater addiction. The vapor in e-cigarettes contains harmful substances, which include formaldehyde, heavy metals, and particles that get stuck deep inside your lungs' air sacs. E-cigarette vape flavoring also contains a buttery chemical called diacetyl that leads to bronchiolitis obliterans, that is also referred to as popcorn lung. Popcorn lung is when scarring of the air sacs in the lungs occurs, which ultimately results in the narrowing of your airway by thickening the airway's walls. E-cigarettes also deliver nicotine through an aerosol that is breathed into the lungs in the same way that a cigarette is smoked. Lastly, e-cigarettes can harm the adolescent's brain, which keeps developing until the age of 25. Here's a very interesting short video I found again on YouTube about popcorn lung. Some interesting facts about smokeless tobacco, which is also known as dip, chew, and snuff, are quite shocking. Smokeless tobacco products contain at least 28 chemicals that causes cancer. It causes gum disease, tooth decay, lung cancer along with other cancers, and it can increase tobacco use among youth along with encouraging them to begin smoking. It isn't worth risking your life or health over a cancer stick. Here's another short video, you guys, about the harms of smokeless tobacco and what it can do to your teeth and breath.
Smokeless tobacco is not safe.
Did you know that if you or anyone quits smoking, chewing, and or vaping, that it can lower the risk of lung cancer at any age? There's no specific age limit to reducing the risk and preventing lung cancer, so take a stance and just say no. Here I wanted to share an image of healthy lungs versus smokers' lungs. On the left there are healthy lungs, where people are able to breathe easy without feeling like they're suffocating, and their lungs are pink and healthy. On the right, it shows smokers' lungs, where people struggle to breathe and the lungs have a dark, brownish-black mottled appearance. Smoking damages the lungs beyond repair and is an addiction that isn't worth risking your future or life. Some of you may ask, how can I prevent cancer? There is no way to prevent yourself from getting lung cancer, but you can help reduce your risks. Some ways to prevent or reduce the risks of getting lung cancer include quitting smoking. This is the number one way to reduce your risk is by smoking, to quit. Avoiding secondhand smoke, exercising and eating a healthy diet, maintaining a healthy weight, getting a lung cancer screening done if you were or are a smoker, use e-cigarettes or use smokeless tobacco, and avoiding exposure to harmful chemicals such as radon and pollution. Radon can be scary because it is colorless and odorless, so it may be one that is hard for you to knowingly avoid, along with avoiding air pollution, but you can do your best at avoiding it. I hope you enjoy this fun and catchy song all about lung cancer as well. I found it quite interesting. Things you can do to be smoke-free, prevent or reduce your risks for lung cancer, and help others around you. In order to be smoke-free, make sure you don't give in to peer pressure. Think about your future and what you want to accomplish. Think about the health risks and the damage it does to your appearance. Get involved in school by playing sports and staying active. Make new friends and try joining in your community efforts to prevent tobacco use by helping them educate about tobacco use. There's a you can in lung cancer prevention. You can all make a difference by quitting or never beginning to use these harmful addictive substances, along with helping friends and family become knowledgeable about the harms of smoking, smokeless tobacco, and e-cigarettes. I've always loved Dr. Seuss and found this quote to be one that really stuck out to me. I do not like cancer here or there. I do not like cancer anywhere, especially in my lungs. Thank you for watching my presentation on lung cancer prevention. I hope you all learned a few new things and enjoyed watching the videos. Do your part in promoting health and wellness around you and your community. Say no to peer pressure and never pick up a bad habit, especially when your life is at stake.